Hey, Dr. Ferguson coming to you from the Passioncam. Last time we were talking about the process of withdrawing and the ending part of the withdrawal and the challenge of not taking any more medication or narcotics. And it's a mindset, and that's an important concept for you to understand. You got to draw a line in the sand when you start this process. The line you got to draw in the sand is I'm not going to do any more drugs. And your why has to be big enough to get you to draw that line and then to keep the line intact, so that when stuff hits the fan, you still don't go back and do the drugs. And this is where it becomes to be so important that your why is big enough. Your why is what's causing you to stop doing the drugs in the first place. And that why has to be big enough and strong enough to keep you from doing the drugs once you no longer having the symptoms, or once you no longer throwing away all this money, or once you build back some of these relationships that you destroyed while you were doing the drugs. That's your why. It might be you're getting ready to lose your kids, you're getting ready to lose your home, you're losing your husband, losing the relationship, losing your wife. I don't know what your why is, but your why has to be big enough to get you to do what you said you were going to do long after the good feeling you had when you said it is gone. Critically important, your why. And this is what's going to help you stay clean. Your why. Why did you get clean in the first place? Why did you go to detox in the first place? Well, most times by the time a person gets to detox, just about everybody they know have kicked them to the curb. And they can't borrow money from anybody. Just about everybody they know doesn't trust them, doesn't want to be around them, etc., etc. I don't know what your why is. Maybe you've already lost a kid to drugs, or maybe you've already lost a spouse to drugs. I don't know what your why is. Maybe you've lost your home or all the money you have. I don't know what your why is. But your why has to be strong enough to get you to do what you said you're going to do long after the good feeling you had when you said it is gone. Now let's add this to being finished. When we start the program, we try to really drive home the why. We try to really make sure the patient has a why are they doing this. Not because my mother wanted me to be here, not because my father was mad with me, not because my kids were upset with me, but because you want to be there. That's what it takes for success. You have to want to be there. And so now that you want to be there, you've started the program, you've been successful in the program, that why that got you in the program has to be the why that keeps you clean the rest of your life. And you have to be strong enough with that why and when you get to that why, you don't just say stuff is hitting the fan and you say, oh, well, I tried and I didn't make it. No, that's no good. The why has to keep you going. And you have to have that why. You have to focus in on that why. So many times when my patients start in the Suboxone program, stuff hits the fan, they go out and do the drugs for that weekend. Or neighbor comes home, or brother comes home, or it's a holiday weekend and all the friends are there, and they do some coke, or they do some crack, or they do some heroin, or they do an opioid, or whatever. So often that's what happens. And then they come into the office, oh doc, I wish I had done it. I didn't even get high. I didn't even feel nothing when I did it. I don't know why I did that. I just did it. You can't have that attitude. You have to know why you did it. You have to stop, sit back, look in the mirror, and say, this is who I am, this is where I'm going, and this is how I'm going to get there. I'm not doing no more drugs. The Suboxone is going to keep me from having withdrawal symptoms, and I'm going to be great. So we'll continue to talk more about this, but it's so important that you got your why fixed in place, and that you understand when we're getting to the end of Suboxone usage, that anxiety can look just like withdrawal. So I try to tell my patients from day one, when they started my program, that these are two hurdles that we're going to have to cross. Understanding that your why has to get you there, and that when you get near the end, anxiety and withdrawal look just the same. And we can do this thing, but we got to work together. All right, on that note, be blessed and have a wonderful day. Bye-bye.